Amoxicillin is a derivative of the antibiotic penicillin. Penicillin was discovered in 1928 by bacteriologist Alexander Fleming when a culture plate growing Staphylococcus bacteria became contaminated with a mold called Penicillin chrysogenum. Fleming found that the mold was inhibiting the growth of the bacteria and isolated the inhibiting substance, penicillin. In the 1930s and 1940s, scientists Howard Florey and Ernst Boris Chain created a concentrated form and performed clinical tests with it, establishing its use as a bacterial killer or a bactericidal antibiotic. In the late 1940s, crystallographer Dorothy Crowfoot Hodgkin worked out the structure of penicillin, allowing synthetic versions to be created. Amoxicillin was derived at Beecham Research Laboratories by adding an extra amino group onto penicillin, and amoxicillin became available in 1972. This addition allows amoxicillin to treat a larger range of bacterial infections. Amoxicillin is very similar to its predecessor, ampicillin, differing only by its extra hydroxyl group. This OH group makes amoxicillin more soluble, allowing the drug to be absorbed more quickly than ampicillin when taken orally. Because of this, amoxicillin is usually administered through oral ingestion through pills or liquid, which sometimes comes in flavors, though it can be injected or provided through an IV drip if the patient would have trouble taking it orally. Amoxicillin is also unaffected by food, unlike ampicillin. Ampicillin needs to be taken on an empty stomach to avoid interference and increase antibiotic absorption, but amoxicillin can be taken with food or without. Amoxicillin and other penicillins are beta-lactam antibiotics, defined by their beta-lactam ring. Beta-lactam rings inhibit the construction of the bacterial cell wall, leading to cell lysis and the destruction of the bacterium. Let's take a closer look. During the formation of a bacterial cell wall, layers of peptidoglycan are linked together by small amino acid cross bridges in a process called transpeptidation, forming the thick cell wall. Beta-lactams bind to the enzymes that link the amino acid cross bridges, inhibiting the enzyme and preventing the synthesis of the cell wall. This also activates autolytic enzymes inside the wall. The enzymes cause the cell wall to rupture, thus killing the bacterium.
Two major enzymes are involved in cross-linking: transpeptidase and D-alanine carboxypeptidase. These enzymes are also known as penicillin-binding proteins because of their ability to bind to penicillins. Eventually, several layers of peptidoglycan are formed, all of which are cross-linked to create the cell wall. Beta-lactam antibiotics include all penicillins that contain a chemical structure called a beta-lactam ring. This structure is capable of binding to the enzymes that cross-link peptidoglycans. Beta-lactams interfere with cross-linking by binding to transpeptidase and D-alanine carboxypeptidase enzymes, thus preventing bacterial cell wall synthesis. By inhibiting cell wall synthesis, the bacterial cell is damaged. Gram-positive bacteria have a high internal osmotic pressure. Without a normal rigid cell wall, these cells burst when subjected to the low osmotic pressure of their surrounding environment. As well, the antibiotic penicillin-binding protein complex stimulates the release of autolysins that are capable of digesting the existing cell wall.
Here's a quick look at penicillin in action, causing lysis in E. coli. Because of the presence of cell walls in many bacteria, penicillins have a wide range of bacteria that they can treat. However, the original penicillin was mostly just able to treat bacteria with a thick outer cell wall, gram-positive bacteria, and it was not as effective when the bacteria had phospholipid membranes surrounding its cell wall layer, or gram-negative bacteria. The added amino group on amoxicillin allows it to penetrate these lipid membranes and reach the cell wall, giving amoxicillin an even broader range of treatment. Some of the most common bacterial infections that amoxicillin can treat include ear, nose, and throat infections, respiratory tract infections, pharyngitis, tonsillitis, and skin infections. There are some natural defenses against penicillins. Specifically, some bacteria create enzymes to link peptidoglycan walls that resist the binding of the beta-lactam ring.
If this remodeled DNA segment codes for cross-linking enzymes, i.e. penicillin binding proteins, the result is the production of altered penicillin binding proteins. These altered penicillin binding proteins can still cross-link the peptidoglycan layers of the cell wall, but have a reduced affinity for beta-lactam antibiotics, thus rendering the bacterium resistant to the effects of penicillin and other beta-lactam agents.
Other bacteria may produce enzymes known as beta-lactamase enzymes that destroy the beta-lactam ring and render it unable to bind to the cross-linking enzymes. The enzymes that specifically target beta-lactam rings in penicillin are known as penicillinase.
The bacteria will begin to produce inactivating enzymes. These enzymes, capable of destroying beta-lactam antibiotics, are known as beta-lactamases.
Beta-lactamase is released from the bacteria and inactivates the drug before it reaches the cell.
Ultimately, the destruction of the beta-lactam ring of the antibiotic renders it incapable of binding to the penicillin binding protein.
Amoxicillin is sometimes coupled with beta-lactamase inhibitors in order to make amoxicillin effective against bacteria that resist penicillins. The beta-lactamase inhibitors that accompany amoxicillin will bind irreversibly to the binding site on the bacterium's penicillinase enzymes, leaving the enzyme ineffective and the way clear for amoxicillin to do its job. One example of this is amoxicillin's use in treating acute otitis media, a painful ear infection where the area behind the eardrum becomes inflamed. It is extremely common in children and is a leading cause of clinic visits by children. The treatment for acute otitis media makes use of clavulanate or clavulanic acid, a beta-lactamase inhibitor that amoxicillin is frequently paired with. Clavulanate prevents the bacteria from developing resistance to amoxicillin, and amoxicillin sweeps in and destroys cell walls to cure the infection. Amoxicillin is also often paired with probenecid, a drug that causes your liver to remove less antibiotic from your system. Your body retains more amoxicillin, causing the antibiotic to be more effective in treating infection. This combination of amoxicillin and probenecid is used in treatment of gonorrhea, a sexually transmitted disease that affects the throat, urethra, rectum, or cervix. This treatment has been found effective due to the fast oral absorption of amoxicillin, the retainment of antibiotic due to probenecid, and the lack of side effects. Amoxicillin and probenecid have also been found to be extremely effective in combating syphilis in patients with HIV. Syphilis is another STD that causes sores on the genitals, rectum, or mouth. The combination of amoxicillin and probenecid was found to be approximately 95.5% successful in treating syphilis in patients with HIV. In addition, amoxicillin can be used in conjunction with other antibiotics to treat stomach ulcers caused by the bacteria Helicobacter pylori. When amoxicillin is paired with either clarithromycin or omeprazole, the ulcer-causing bacteria are effectively eliminated. As you can see, amoxicillin's range is wide and diverse, and it has the ability to treat many different bacterial diseases. In addition to this, its beta-lactam ring may also have a use in protecting nerve cells from getting damaged. Nerve cells communicate by sending molecules called neurotransmitters, such as glutamate, to each other. However, excess glutamate outside the neurons can overstimulate and destroy neurons. This is a factor in several neurological diseases like amyotrophic lateral sclerosis, or ALS. The use of amoxicillin appears to stimulate the production of transport proteins that move glutamate back into the nerve cells, avoiding high concentrations of glutamate outside the cell. Overall, amoxicillin is an effective, widely used, fast-acting treatment for bacterial infections. It can be combined with many other drugs to expand its range and effectiveness, and it may even have a future in combating nerve cell death, a hot topic in research.